Hello everyone, we're Group 4 and our presentation today looks at new nurse residency and mentorship programs and their impact on retention. I'm Cristina Santayana and I'm presenting alongside Priscilla Johnson on behalf of our group, which also includes Alissa Hernandez and Aleen Williams. We'll walk you through the evidence we reviewed, what it tells us about improving retention for newly licensed RNs, and what we recommend for practice. Before we get into the literature, we want to explain why our group picked this topic in the first place. Newly licensed nurses are leaving their first jobs at a rate that should concern all of us. The national RN turnover rate was 16.4% in 2024. And when we look specifically at new grads, that number climbs to 12 to 25% annually. About 35% of newly licensed nurses are gone from their first position within just 2 years. This isn't only a staffing problem. When we lose nurses this fast, it destabilizes units and stretches nurse-to-patient ratios, and that puts patient safety at risk. Inadequate mentorship has been tied directly to more clinical errors. So the people paying the price aren't just the nurses who leave, it's the patients and the staff who stay behind. And financially, this is expensive. Replacing one RN costs over $61,000 on average, and hospitals are losing anywhere from $3.9 to $5.7 million a year because of turnover. Nationally, almost 900,000 RNs, close to 1 in 5, have said they intend to leave the workforce by 2027. So what's happening right now in most hospitals? Current practice usually means a standard orientation period with an assigned preceptor and a competency checklist. The problem is that orientation ends often before a new nurse has really adjusted to working independently. After that, mentorship and support become inconsistent. It depends on the unit, the preceptor, even the hospital. There's no national requirement for a structured nurse residency program. So what exists today is a patchwork, not a standard. And that's the gap our project is built around. Now that we've laid out the problem, we want to walk through what the evidence shows. 2 systemic reviews, Mohammed and Al-Himayat in 2024, and Vasquez Calatayud and Esaveri Ascoiti in 2023, both confirm that structured nurse residency programs improve 12-month retention compared to nurses with no program. The numbers support this. ASBR's 2019 review found 1-year retention rates for residency participants ranging from 74% to 100%. Mohammed and Al-Himayat reported individual cohort rates between 77.27% and 90.20%. Compare that to the national average for non-nurse residency program nurses, which sits around 43% to 56%. At the national level, Vizient and AACN data shows the same pattern. 89% retention for residency participants versus a 76.2% national average. And on a multi-site evaluation, Shiners and colleagues in 2021 found higher retention and lower turnover compared to national benchmarks. Cohen colleagues in a 2023 single-site study found improved retention and competency among residency participants. A pattern stood out across the literature. Programs running about 12 months, combining mentorship, preceptor support, and competency-based training showed the strongest effect. Vasquez Calatayud and Esaveri Ascoiti found this in their review. Fila and colleagues in a 2021 study of a 1-year accredited residency program found intent to leave peaked at the 12-month mark, the critical window for retention efforts. Van Camp and Chappie, in a 2017 systemic review of 11 studies, found structured residency programs improved retention, job satisfaction, and confidence compared to traditional orientation alone. Mohammed and Al-Himayat, in a 2024 systemic review, reached the same conclusion. Traditional orientation alone has not demonstrated effectiveness for 12-month retention. Based on the problem we've described and the evidence we just reviewed, this is the question that guided our project. In newly licensed registered nurses working in acute care hospitals, how did participation in a nurse residency and mentorship program compared with no structured residency or mentorship program affect nurse retention rates at 12 months? This is a foreground question since we're directly comparing two groups, nurses who go through a structured program and nurses who don't. That comparison is what lets us pull together the evidence you just saw, and it's the question our methods and results are built to answer. Our literature search was designed to find the strongest evidence available. We searched PubMed, CNL, and Medline because they're well-established databases for nursing and healthcare research. We limited the search to studies on newly licensed registered nurses in acute care hospitals who participated in structured nurse residency programs. We excluded studies that didn't match our PICO question, such as those involving experienced nurses or non-hospital settings. Our search terms included keywords like new nurse, acute care, hospital, structured, first year, graduate, residency, and retention, terms pulled directly from how these concepts are indexed in the databases we searched. From there, we applied a screening process, peer-reviewed sources only, published in English, and within the last 10 years. That combination gave us a manageable, high-quality pool of literature to screen for full text review. To analyze the literature, we followed the Johns Hopkins evidence-based practice model. The synthesis table allowed us to compare findings across studies, while the hierarchy of evidence helped us evaluate the strength of the research. Together, these tools guided the development of our evidence-based recommendations. I'll now hand it over to Priscilla, who will continue with our findings.
Thank you, Cristina. Searching individually across CNL, Medline, and PubMed, our team identified 80 records. After removing 45 duplicates, we screened 35 records by title and abstract, excluding 15 that didn't fit our population or setting. That left 20 articles for full text review. After excluding studies unavailable in full text, not in English, or addressing 12-month retention, we arrived at the 10 studies we summarized in Appendix G. So let's talk about what we actually found. We reviewed 10 studies in total. 3 were level 1 evidence, meaning systematic reviews and 1 large program evaluation, and 7 were level 3, mostly systematic reviews and retrospective or cross-sectional designs. One thing worth noting is what we didn't find. There were no level 2, level 4, or level 5 studies in this body of evidence. That means no quasi-experimental designs and nothing based on clinical guidelines or expert opinion. All 10 studies were rated good quality, but it's important to be transparent here. None of them use a true randomized controlled trial. That's a real limitation of the evidence. And it's part of the reason our overall evidence rating came out as good and consistent rather than strong and compelling. When we look across the evidence, one finding was remarkably consistent. Structured nurse residency and mentorship programs improve first-year nurse retention. Although the residency programs varied somewhat in design, the most successful programs shared several common elements. They typically lasted about 12 months and combined formal education with mentorship, preceptor support, and competency-based learning. Both systematic reviews included in our evidence supported this approach. Another important finding was the difference in retention rates. Residency participants consistently demonstrated one-year retention rates ranging from 74 to 100%, well above the national average reported for nurses who received only traditional orientation. Webb and colleagues expanded on those findings by showing that residency programs improve quality and safety outcomes as well. That tells us that these programs benefit both the individual nurse and the organization by developing a more prepared and confident workforce. Finally, Fella and colleagues identified the 12-month mark as the time when nurses are most likely to consider leaving their position. This reinforces why mentorship shouldn't end after orientation. Continued support throughout the first year gives new nurses the guidance they need during one of the most challenging periods of their transition into practice. The final theme that caught our attention from the evidence is that the impact of residency programs extends well beyond individual nurses. Shinners and colleagues found that the hospitals with structured residency programs experience greater workforce stability and lower turnover, creating a stronger and more consistent nursing workforce. Those organizational benefits are especially important given the financial costs and staffing challenges associated with new graduate nurse turnover. Hong and colleagues also helped explain why these programs are effective. Their study found that nurses are more likely to remain with an organization when they develop a strong professional identity, receive meaningful organizational support, and have positive expectations about their work environment. Residency and mentorship programs help foster each of those factors. Overall, the evidence suggests that investing in structured nurse residency and mentorship programs benefits everyone involved. Newly licensed nurses are better prepared for practice. Organizations experience improved retention and workforce stability, and patients ultimately receive safer, higher quality care. This body of evidence does have real limitations. Many studies were limited to single health systems or specific regions like UAE-based or state-specific programs, which restricts how confidently we can generalize to broader U.S. or global practice. Most studies were also retrospective or cross-sectional, with few randomized trials or longitudinal designs, which limits how strongly we can draw cause and effect conclusions. Small sample sizes and reliance on self-report surveys adds further risk for bias. Even so, these limitations don't negate the overall trend. The direction of the findings was remarkably consistent. Residency and mentorship programs were repeatedly associated with improved retention. A few more limitations stand out. Measurement tools varied widely across studies, from surveys like Cassie-Fink to organizational HR databases, which made direct comparison difficult. Some studies, like Hong and colleagues, measured intention to stay rather than actual turnover, which isn't quite the same thing. That inconsistency, along with small sample size, is part of why the systematic reviews couldn't run a formal meta-analysis. Several studies also didn't report reliability coefficients like Cronbach's alpha, making it harder to judge how consistent their measures really were. Together, these gaps point to a need for more rigorous, standardized, and contemporary research on nurse residency outcomes. The evidence supporting these recommendations was good and consistent, spanning level 1 and level 3, with no level 2 studies included. Residency programs consistently improve retention, confidence, and transition to practice, with the strongest models being structured, year-long, and combining clinical skill development with professional support. Based on this, we recommend organizations pilot structured, year-long residency programs with mentorship and competency validation, starting on units with documented turnover before scaling further. Programs should use standardized 12-month retention metrics, and leaders should treat retention as a key performance indicator tracked and reported like other quality measures. Finally, mentorship needs real investment, meaning protected preceptor time built into the role, not squeezed around a full patient assignment. These are the recommendations we're basing our practice change strategy on for the final paper. For education and policy, we recommend strengthening academic practice partnerships for more seamless onboarding, and adding reflective learning and resilience training to help with new nurses managing their first-year stress. We also recommend certifying preceptors before program launch and tracking residency completion in HR systems so pilot outcomes can actually be measured against retention data. Advocating for national accreditation standards keeps residency programs consistent across hospitals, and multi-site collaboration expands the evidence base and improves program design going forward. Finally, simulation alongside strong mentorship reinforces clinical judgment and prepares new graduates for safe, confident practice. To wrap up, across all 10 studies, the message was the same. Structured residency and mentorship programs consistently improves retention, competence, and satisfaction among new graduates. Even though study designs varied and none used randomized controlled trial, the direction of the evidence never changed. The strongest results came from programs that ran about a year, paired new nurses with dedicated mentors, and were built into the organization's culture, not treated as an add-on to orientation. Given this evidence, we believe organizations should pilot structured residency programs on units with documented turnover, a low-risk way to test the model and build a case for scaling hospital-wide. Investing in these programs is one of the most direct ways to support workforce stability, protect patient safety, and set new nurses up for long-term success. This concludes our presentation on new nurse residency and mentorship programs. Thanks for watching.